THECILI and THS Understanding and Preventing the Top 5 Causes of Mortality. After 65, have you ever paused to wonder how many years you might have left? It's a sobering thought, but one that becomes increasingly relevant as we age. The advancing years bring subtle changes, persistent aches, disrupted sleep, shortness of breath after brief activity, gradual shifts that we often dismiss as inevitable aspects of aging. Yet these seemingly minor symptoms frequently serve as early warnings from a body in distress. Consider how many people in their 60s and 70s leave us unexpectedly, individuals who might have enjoyed many more years of life had they recognized and responded to their body's quiet alarms. While we often attribute health outcomes to fate or genetics, the truth is far more empowering. Our longevity frequently rests within our own hands, determined by our vigilance and response to early warning signs. Most degenerative conditions announce themselves through subtle signals, long before they become life-threatening, explains Dr. Eleanor Mitchell, geriatric specialist at Northwestern Medical Institute. The tragedy lies in how often these signals go unrecognized, or dismissed until intervention options become severely limited. Your body consistently communicates its condition through fleeting pains, minor changes in daily habits, shifts in energy levels, all serving as valuable intelligence about your internal state. Unfortunately, many dismiss these signals, assuming discomfort naturally accompanies aging. This dangerous misconception leads many to ignore critical warnings until serious, sometimes irreversible damage occurs. What essential warning signs should you never ignore after 65? Which signals might represent your body's final opportunity to prevent disease and preserve your health? Today, we'll explore 5 critical indicators that demand immediate medical attention. If you recognize any of these in yourself or loved ones, don't hesitate, seek medical evaluation immediately. Early detection often makes the difference between effective intervention and tragic outcomes. Let's examine these 5 crucial warning signs and understand why they deserve your immediate attention. Warren chest discomfort and breathing difficulty, your heart's desperate call for help. Have you ever experienced chest tightness, difficulty breathing, or irregular heartbeats, only to dismiss them as temporary fatigue or weather-related discomfort? This common rationalization leads countless individuals to ignore their cardiovascular system's desperate pleas for attention. The sobering reality is that many cardiac emergencies strike without dramatic warning. Seemingly healthy individuals shopping at markets or enjoying time with grandchildren in the morning can face life-threatening cardiac episodes by afternoon. While some survive these events, others never return to their families, and most tragically, many had experienced warning signs they simply chose to ignore. The heart has a remarkable ability to compensate for developing problems, notes Dr. Victor Reynolds, cardiologist at Riverside Cardiac Center. It will continue functioning despite increasing distress until it reaches a critical threshold. By then, the window for preventative intervention has often closed. Pay careful attention to chest discomfort that appears during physical exertion, climbing stairs, carrying groceries, or even walking moderate distances. If you notice irregular heartbeats, skip beats, or sensations of pressure or heaviness in your chest, these may indicate coronary artery disease, atherosclerosis, or an impending myocardial infarction. Consider Margaret's experience at 73. She noticed increasing breathlessness when climbing the stairs to her apartment. I just attributed it to getting older, she recalled. It wasn't painful, just inconvenient. Only when she nearly collapsed while shopping did she seek medical attention. The diagnosis: severe coronary artery blockage requiring immediate intervention. Her cardiologist later explained that her body had been sending warning signals for months. Many seniors hesitate to seek medical evaluation, worried about inconveniencing family members or dismissing symptoms as normal aging. This dangerous mindset can have fatal consequences. Your health and life deserve priority. When your heart signals distress, respond immediately. Even brief delays can permanently alter your future. If you find this information valuable, please share it with friends and family. A simple reminder might literally save someone's life. Onset to persistent cough and breathing difficulties, your lungs' silent distress signal. Have you experienced a lingering cough lasting weeks despite medication? Perhaps you've attributed it to seasonal changes or minor throat irritation, reassuring yourself that it's nothing serious. This common rationalization represents a potentially dangerous misunderstanding of how respiratory conditions develop and progress. Many individuals diagnosed with chronic obstructive pulmonary disease, COPD, severe pneumonia, or even lung cancer share a common regret: ignoring early respiratory symptoms that could have led to earlier intervention. What begins as a dry cough often gradually evolves into productive coughing, progressively worsening breathing difficulties during physical activity, and eventually blood-tinged sputum, all while the sufferer continues attributing these changes to common cold or routine throat inflammation. Dr. Sophia Chang, pulmonologist at Eastern Respiratory Institute, emphasizes lungs demonstrate remarkable resilience, but once significantly damaged, their recovery capacity becomes severely limited. Early intervention can prevent irreversible tissue destruction, while delayed treatment often leaves us managing symptoms rather than resolving underlying conditions. Our lungs endure considerable daily challenges: environmental pollutants, cooking fumes, secondhand smoke, elements that don't cause immediate catastrophic damage but gradually erode respiratory function over decades. When breathing becomes increasingly labored, when you require elevated sleeping positions to breathe comfortably, when ordinary tasks leave you breathless, these signal your lungs' diminished capacity. Thomas, a retired teacher, ignored his persistent cough for months. "I kept thinking it would clear up on its own," he explained. "By the time I finally saw a doctor, I had developed severe pneumonia that required hospitalization and left permanent scarring in my lungs. Had I sought treatment earlier, I might have avoided this permanent damage." If you or someone you care about experiences coughing persisting beyond 3 weeks, particularly when accompanied by breathing difficulties, wheezing, or chest tightness, seek immediate medical evaluation. A single timely examination could prevent potentially devastating respiratory complications. Don't wait until breathing itself becomes laborious. Share this information with loved ones. Your awareness might help someone detect early respiratory issues when intervention can still make a critical difference. Warning: 3. Sudden confusion and limb weakness, your brain's emergency distress signal. Have you ever suddenly forgotten what you were doing? Found yourself struggling to find words during conversation? Experienced unexpected weakness in your hands, dropping objects without understanding why? Perhaps you've noticed momentary balance issues, needing to steady yourself against walls to prevent falling. These symptoms don't simply represent normal aging, they may signal an impending stroke, a medical emergency requiring immediate response. Many mistakenly believe strokes occur without warning, but neurological research demonstrates that the brain often sends clear distress signals well before major events. The critical question becomes whether we recognize and respond to these warnings. A stroke occurs when blood vessels supplying the brain become blocked or rupture, depriving brain tissue of oxygen, explains Dr. Nathaniel Parker, neurologist at Metropolitan Neuroscience Center. Within minutes of oxygen deprivation, neural tissue begins dying. Without prompt intervention, patients may suffer permanent paralysis, speech impairment, or fatality. The most concerning aspect of stroke is that many cases could be prevented with timely recognition and response. Remember these 3 critical stroke warning signs using the acronym FAST: facial drooping, asymmetrical smile, arm weakness and inability to raise both arms equally, speech difficulties, slurred or confused language. Time is literally brain tissue. Every minute without treatment means greater potential damage. Elizabeth, 68, was preparing dinner when she suddenly couldn't hold her knife properly. My right hand just wouldn't work right, she recalled. Then I noticed my words weren't coming out clearly. Fortunately, her daughter recognized these warning signs and called emergency services immediately. This prompt response allowed Elizabeth to receive clot-dissolving medication within the critical window, preventing permanent disability. Strokes don't discriminate by age, increasingly affecting individuals in their 50s, 40s, and even younger. Never dismiss neurological symptoms, regardless of their duration. Minutes matter in stroke response, and delayed treatment can result in irreversible consequences. If this information resonates with you, please share it with family and friends. Understanding stroke warning signs enables everyone to recognize these emergencies and potentially save lives, perhaps even your own. Warning sign 4. Explain weight loss and digestive changes, the silent harbinger of cancer. Have you noticed unintentional weight loss recently? Dropped 3 to 5 kilograms or more over several months without changing your diet or exercise habits? While some might consider unexpected weight loss fortunate, medical professionals recognize it as a potential early indicator of several serious conditions, particularly various cancers. Unexplained weight loss often ranks among the earliest signs of liver, stomach, colorectal, pancreatic, and lung malignancies. Beyond weight changes, you might experience decreased appetite, persistent bloating, or diffuse abdominal or back pain. Unfortunately, many dismiss these symptoms as digestive disturbances or age-related changes, often self-treating with over-the-counter remedies while underlying conditions progress unaddressed. Cancer develops incrementally over years before producing obvious symptoms, notes Dr. Rebecca Hamilton, oncologist at Western Memorial Cancer Center. By the time patients experience severe symptoms, the disease has typically progressed significantly. However, the body usually provides subtle warnings much earlier if we're attentive enough to recognize them. Pay attention to persistent changes in bowel habits, chronic constipation, or diarrhea, particularly when they represent departures from your normal patterns. Black tarry stools or blood in bowel movements may indicate colorectal or gastric cancer and warrant immediate evaluation. Similarly, difficulty swallowing or feeling food, sticking, during meals might signal esophageal abnormalities requiring investigation. Robert 71 noticed gradual weight loss and occasional abdominal discomfort, but attributed these changes to normal aging. I actually thought losing weight without trying was a good thing, he admits. After finally seeking medical attention for increasing fatigue, he received a diagnosis of advanced colorectal cancer. If I'd known unexplained weight loss could indicate cancer, would have seen my doctor months earlier. Cancer doesn't typically develop overnight but progresses silently over years. Your body continuously signals developing problems. The question becomes whether you're listening attentively enough to notice. Early detection dramatically improves treatment outcomes for most malignancies, while delayed diagnosis significantly reduces survival possibilities. If you experience unexplained weight loss, diminished appetite, persistent digestive changes, or unusual pain patterns, seek immediate medical evaluation. A timely assessment might extend your life by decades. Remember, health represents your most precious resource, irreplaceable once lost. Please consider saving this information for personal reference and sharing it with loved ones. Awareness of these warning signs could prompt earlier detection and potentially life-saving interventions. Warning signs 5 dizziness and balance problems precursors to devastating falls. Have you experienced sudden lightheadedness while walking around your home, requiring you to quickly grasp furniture or walls for support? Perhaps you've noticed darkened vision when standing from seated positions, or momentary unsteadiness that nearly resulted in falls. These seemingly minor episodes demand serious attention. They frequently precede devastating falls that permanently alter seniors' independence and longevity. Many incorrectly assume dizziness and balance issues represent inevitable aging consequences. But these symptoms often indicate underlying medical conditions requiring treatment: low blood pressure, vestibular disorders, or most concerning, transient ischemic attacks, mini strokes. When accompanied by severe headaches, visual disturbances, or ear discomfort, immediate medical evaluation becomes critically important as these may signal reduced oxygen supply to your brain or impending stroke. Beyond signaling potential neurological emergencies, balance disturbances represent the primary cause of falls among older adults, events that frequently produce catastrophic consequences. Dr. Jennifer Lawrence, geriatric specialist, emphasizes, falls aren't merely accidents. They're often the culmination of multiple health factors that, if identified earlier, could have been addressed before causing injury. My own grandfather's experience illustrates this reality. A robust man who maintained a vegetable garden and regularly cycled to the market. His life changed dramatically after a single fall. One rainy afternoon, he slipped on wet tiles while descending his front steps. Initially dismissing the incident, he soon found himself unable to stand independently. Hospital evaluation revealed a fractured hip requiring immediate surgery. Following this operation, his mobility became permanently compromised. Extended bed rest weakened his previously strong constitution, diminishing his appetite and overall health. Numerous complications followed, and within a year, the vibrant man who had independently managed his household became entirely dependent on family care. His story isn't unique. Countless seniors experience similar trajectories following falls. Falls among older adults don't represent simple accidents, but frequently initiate devastating health cascades. When younger, falling typically means minor scrapes and quickly continuing activities. However, for older individuals with brittle bones, diminished muscle mass, and slower reflexes, a single fall can permanently eliminate independent mobility. Have you noticed unsteadiness when descending stairs? Experienced dizziness when standing quickly? Stumbled over household objects during nighttime bathroom visits? These represent serious fall risk factors requiring immediate attention. I share my grandfather's story not to create anxiety, but to emphasize how momentary carelessness can permanently alter your life trajectory. Increased awareness and preventative measures today can preserve your independence and vitality for years to come. If you've witnessed someone's health deteriorate following a fall, or experienced a frightening near miss yourself, please share your experience. Your story might motivate others to implement critical safety measures before experiencing similar events. TAFAVDADLTTH 65 Understanding what you're fighting, dear friends. While recognizing warning signs represents critical knowledge, understanding the conditions they signal provides equally important context. After age 65, 5 major health threats account for the vast majority of mortality and serious disability. Let's examine each condition, their prevalence, and most importantly, how they develop over time. DL8 Cardiovascular disease. The relentless silent killer, the heart represents our most dedicated organ, working continuously from before birth until our final moments without a single opportunity to rest. Yet despite this remarkable reliability, heart disease remains the leading cause of death among older adults worldwide. Myocardial infarction, heart attack, stroke, and heart failure can strike with devastating suddenness. But the sobering reality is that these sudden events typically result from conditions developing over decades. Atherosclerosis, the progressive narrowing of arteries through plaque accumulation, often begins in early adulthood before producing noticeable symptoms in senior years. Many seniors mistakenly believe they've maintained healthy hearts because they've never experienced chest pain or diagnosed conditions. However, Dr. Victor Reynolds cautions, cardiovascular disease doesn't always announce itself through dramatic symptoms. Many patients experience only subtle manifestations, mild fatigue during activity, occasional breathlessness, or slight ankle swelling, signs frequently attributed to normal aging rather than developing heart conditions. Cold extremities, numbness or tingling sensations, occasional breathlessness, or unexplained rapid heartbeats may indicate your heart struggles to pump efficiently. Many incorrectly assume heart disease exclusively affects wealthy individuals with sedentary lifestyles and excessive diets. But this dangerous misconception overlooks other significant risk factors: chronic stress, undiagnosed sleep apnea, genetic predispositions, and inflammatory conditions. The emotional impact of cardiovascular disease extends beyond physical suffering. Raymond, 69, describes his post-heart attack experience. Before my heart attack, I believed myself invincible, never monitoring my blood pressure or considering my diet's long-term impact. Now, everyday activities carry newfound anxiety. I constantly wonder, will this be the day my heart fails again? Your heart has faithfully executed billions of contractions throughout your lifetime. When it finally signals distress, it genuinely needs attention. Honor this remarkable organ through preventative measures and prompt response to warning signs. Your heart represents your most loyal companion, sustaining life every moment since before birth. DO82, respiratory disease. When every breath becomes a struggle each day, we perform approximately 20,000 breathing cycles without conscious effort or appreciation. Yet for millions of seniors worldwide, this once automatic function becomes an increasingly difficult struggle as respiratory disease progressively compromises lung function. After age 65, conditions like chronic obstructive pulmonary disease, COPD, pneumonia, and lung cancer represent leading mortality causes. These conditions frequently develop insidiously, beginning with occasional coughing, gradual exercise intolerance, and increasing breathlessness during routine activities before progressing to severe respiratory compromise. Respiratory tissues possess limited regenerative capacity compared to other body systems, explains Dr. Sophia Chang. Once damaged through chronic inflammation, infection, or carcinogenic exposure, their restoration capability remains fundamentally restricted. Prevention and early intervention, therefore, become crucial strategies for maintaining respiratory health. Many respiratory symptoms initially appear minor: a persistent cough, increased recovery time following respiratory infections, or subtle changes in exercise tolerance. Unfortunately, these early manifestations frequently receive inadequate attention until permanent damage occurs. Isabella, 73, shares, I dismissed my chronic cough as normal winter bronchitis for 3 years before finally seeking evaluation. By then, my COPD had progressed to requiring supplemental oxygen during even minimal activity. Respiratory vulnerability increases significantly with age as immune function naturally declines. Mucociliary clearance of the lungs' self-cleaning mechanism becomes less efficient, and accumulated lifetime exposures to environmental irritants manifest as tissue damage. While smoking represents the most recognized respiratory risk factor, significant danger also arises from air pollution, occupational exposures, recurrent infections, and even cooking fumes from poorly ventilated kitchens. Have you noticed increasing respiratory infections requiring longer recovery periods? Do temperature changes trigger coughing episodes more frequently than before? Does lying flat exacerbate breathing difficulties? These subtle changes warrant professional evaluation, as they frequently represent early manifestations of developing respiratory conditions. Remember, oxygen represents your body's most immediate requirement. While you might survive days without water or weeks without food, oxygen deprivation causes cellular damage within minutes. Prioritize respiratory health accordingly, recognizing that each unrestricted breath represents a precious gift deserving protection. DO83, neurodegenerative conditions. When memory and identity begin fading, perhaps no health challenge creates greater anxiety among aging individuals than cognitive decline. The prospect of gradually losing memories, independence, and ultimately self-identity generates profound fear, and with good reason. After 65, neurodegenerative conditions including Alzheimer's disease, Parkinson's disease, and vascular dementia become increasingly prevalent, fundamentally altering both existence quality and duration. These conditions typically begin subtly: occasional forgetfulness, misplaced items, or minor word-finding difficulties easily attributed to normal aging. However, these seemingly innocent manifestations may represent early neurological changes that, without intervention, progressively worsen over time. Dr. Nathaniel Parker explains, cognitive decline rarely occurs suddenly. Most neurodegenerative conditions develop incrementally over years or even decades before becoming clinically apparent. During this presymptomatic period, biochemical and structural brain changes accumulate, eventually surpassing the brain's compensatory capabilities and manifesting as noticeable symptoms. Initial cognitive changes might include difficulty remembering recent conversations, challenges with complex tasks previously performed effortlessly, or subtle personality alterations. As degeneration progresses, individuals may struggle with routine activities, meal preparation, medication management, personal hygiene, eventually requiring comprehensive assistance with basic functions. Beyond memory impairment, neurodegenerative conditions frequently cause profound emotional suffering for both patients and families. James describes watching his mother's Alzheimer's progression. The most painful aspect wasn't her forgetting appointments or misplacing belongings. It was the day she looked at me with confusion and asked who I was. In that moment, I realized I was losing her while she was still physically present. Multiple factors influence cognitive decline risk, including genetics, cardiovascular health, educational attainment, and lifestyle factors. Research increasingly demonstrates that individuals maintaining active social connections, regular intellectual stimulation, physical activity, and nutritional adequacy typically preserve cognitive function significantly longer than socially isolated, sedentary counterparts. Have you noticed yourself becoming increasingly forgetful? Do familiar tasks require more concentration than before? Do family members comment on personality changes you haven't recognized? While these changes warrant medical evaluation, they simultaneously offer opportunities for implementing protective measures before significant impairment develops. Remember, your brain contains your lifetime experiences, relationships, and essential personhood. Protecting cognitive function means preserving not just information processing capability, but your fundamental identity and independence. Few investments yield greater returns than those protecting neurological health. DL84 Cancer, the emperor of all maladies. The word cancer continues evoking profound fear, and understandably so. This collection of diseases, characterized by abnormal cellular growth and spread, represents a leading mortality cause among older adults, with incidence rates increasing significantly after age 65. Unlike conditions producing consistent early symptoms, cancer's initial manifestations vary tremendously depending on affected organs and individual factors. However, unexplained weight loss, persistent fatigue, change in bowel or bladder habits, unusual bleeding, and non-healing sores represent common early warnings across multiple cancer types. Cancer represents the ultimate cellular rebellion, explains Dr. Rebecca Hamilton. Normal cellular growth and division occurring throughout life becomes dysregulated through genetic mutations accumulating over decades. These mutations eventually enable cells to evade normal growth controls, avoid programmed cell death, and ultimately invade surrounding tissues. Perhaps the most troubling aspect of cancer lies in its deceptive progression. Initial developmental stages typically produce minimal or non-existent symptoms, creating a dangerous false security. By the time obvious manifestations develop, significant pain, visible masses, organ dysfunction, the disease has frequently advanced substantially, limiting treatment options and reducing survival probability. The psychological impact of delayed diagnosis often exceeds physical suffering. Henry, diagnosed with advanced pancreatic cancer at 74, shares, "For months, I experienced occasional abdominal discomfort and diminished appetite, but continuously postponed medical evaluation, assuming these represented normal aging changes. I realized my body was desperately signaling something seriously wrong, but I simply wasn't listening carefully enough." Cancer risk increases with age through several mechanisms: accumulated environmental exposures, declining immune surveillance, diminished DNA repair capability, and lengthened mutation exposure duration. While genetic factors influence cancer susceptibility, lifestyle and environmental exposures typically play substantially larger roles in most malignancies' development. Have you experienced unexplained appetite changes recently? Do minor injuries heal more slowly than previously? Has your energy level significantly decreased without apparent cause? While numerous benign conditions might explain these changes, they simultaneously represent potential early cancer warnings deserving professional evaluation. Remember, cancer detected early frequently responds well to treatment, often resulting in complete remission or cure. The same malignancy discovered months or years later may prove resistant to intervention. Regular preventive screenings and prompt attention to unusual symptoms provide your strongest protection against this formidable health threat. D8LYTR8 falls and related injuries, preventable tragedies. While less frequently discussed than diseases mentioned previously, falls and their resulting injuries represent a leading mortality cause among seniors worldwide. These seemingly minor accidents frequently initiate devastating health cascades, fundamentally altering both quality and duration of remaining life. For younger individuals, falling typically represents a momentary inconvenience, perhaps resulting in minor bruising or temporary embarrassment. However, for those over 65, these same incidents often produce fractures, particularly hip fractures, traumatic brain injuries, or severe soft tissue damage requiring lengthy rehabilitation and frequently resulting in permanent functional decline. Fall-related injuries represent particularly tragic health events because of their preventability, notes Dr. Jennifer Lawrence. Unlike many health conditions developing through complex genetic and environmental interactions, falls typically result from identifiable, modifiable risk factors that, once addressed, significantly reduce incident probability. The consequences of serious falls extend far beyond immediate injuries. Prolonged immobility during recovery accelerates muscle loss, reduces cardiovascular efficiency, increases infection susceptibility, and frequently triggers psychological consequences including depression and fear-induced activity restriction. This combination often creates functional decline exceeding direct injury effects. Patricia describes her 83-year-old father's experience. Before his fall, Dad lived independently, gardening daily and regularly, walking to local shops. After fracturing his hip, everything changed. Despite successful surgery, his recovery period brought multiple complications. The previously independent man became permanently dependent on a walker, developed significant anxiety about leaving home, and lost substantial quality of life, all from a single momentary accident. Multiple factors contribute to increased fall risk with advancing age. Vision changes, medication side effects, environmental hazards, reduced muscle strength, balance impairments, and chronic conditions affecting gait stability. Fortunately, comprehensive fall prevention programs addressing these factors demonstrate remarkable effectiveness in reducing both fall incidence and severity. Have you noticed increased unsteadiness recently? Do you feel momentarily disoriented when changing positions? Have you experienced near-miss incidents where you barely prevented falling? These warning signs deserve immediate attention and intervention before catastrophic events occur. Remember, independence represents one of life's most precious assets, particularly in advanced age. Protecting yourself against falls preserves not just physical health but fundamental autonomy and dignity that, once lost, frequently prove irrecoverable despite extensive rehabilitation efforts. Langangasirits 5 Essential Strategies for Extending Healthy Life After 65. Dear friends, while understanding health threats represents crucial knowledge, even more important is implementing effective strategies to prevent or manage these conditions. The encouraging news. Research consistently demonstrates that lifestyle modifications initiated even in advanced age significantly improve health outcomes and extend active lifespan. Let's explore 5 evidence-based approaches for preserving health and independence throughout your remaining years. Lagasprat 1 Nurturing cardiovascular health. Befriend your faithful heart. Your heart represents your body's most remarkable organ, contracting approximately 100,000 times daily without a moment's rest throughout your entire lifetime. Despite this extraordinary reliability, cardiovascular disease remains the leading mortality cause among seniors worldwide. Fortunately, research consistently demonstrates that appropriate lifestyle modifications substantially reduce cardiac risk even when implemented after age 65. Heart health represents a partnership between genetics and lifestyle, explains Dr. Victor Reynolds. While we cannot alter our genetic predispositions, we maintain considerable influence over how these genetic tendencies manifest through our daily choices. Even individuals with strong family histories of heart disease can significantly modify their personal risk through appropriate interventions. Begin by understanding your cardiac baseline through regular blood pressure monitoring, cholesterol screening, and diabetes assessment. These simple measurements provide crucial information about your cardiovascular status and help identify developing problems before they produce serious consequences. For those already diagnosed with hypertension, dyslipidemia, or diabetes, medication adherence and regular monitoring represent non-negotiable priorities. Physical activity offers perhaps the most powerful cardiovascular protection available. Research demonstrates that moderate activity, even simply walking 30 minutes daily, significantly reduces heart attack and stroke risk while improving cardiac efficiency. Complementary resistance exercises, if appropriate for your fitness level, further enhance cardiovascular benefits by improving metabolic health and reducing inflammation. Dietary patterns profoundly influence cardiac outcomes. Mediterranean-style eating emphasizing vegetables, fruits, whole grains, lean proteins, and healthy fats consistently demonstrates superior cardiovascular protection compared to typical Western diets. Additionally, sodium restriction, processed food limitation, and moderate alcohol consumption should, if any, further support cardiac health. Stress management deserves particular attention for heart protection. Chronic psychological stress triggers inflammatory cascades damaging blood vessels while promoting atherosclerosis development. Practices including meditation, deep breathing exercises, adequate sleep, and meaningful social connections all contribute to stress reduction and corresponding cardiovascular protection. Consider your heart as your most faithful companion, one deserving exceptional care after decades of reliable service. Similar to nurturing important relationships, cardiovascular health requires consistent attention rather than sporadic intensive efforts. The rewards for this attentiveness include not just extended lifespan, but enhanced life quality through improved energy, functional capacity, and symptom reduction. Lung-2 preserving respiratory vitality. Every breath matters. While we might survive days without water or weeks without food, oxygen deprivation produces cellular damage within minutes, highlighting our absolute dependence on respiratory function. After age 65, maintaining lung health becomes increasingly crucial as natural age-related changes combine with lifetime environmental exposures to challenge respiratory efficiency. Respiratory health represents both vulnerability and resilience. Notes Dr. Sophia. While aging naturally reduces pulmonary reserve and environmental exposures accumulate, over decades, practical interventions can substantially preserve respiratory function well into advanced age when consistently applied. Begin protecting your lungs by minimizing harmful exposures. Smoking cessation at any age improves respiratory outcomes even after decades of tobacco use. Similarly, reducing exposure to environmental pollutants, household chemicals, and poorly ventilated cooking fumes provides meaningful protection against progressive lung damage. Regular physical activity significantly enhances respiratory function through multiple mechanisms, strengthening respiratory muscles, improving oxygen utilization efficiency, enhancing airway clearance, and reducing inflammatory processes. Even gentle exercises like walking, swimming, or Tai Chi provide substantial respiratory benefits when performed consistently. Breathing exercises deserve special consideration for respiratory maintenance. Practices involving controlled breathing patterns, diaphragmatic engagement, and extended exhalation improve respiratory muscle coordination while maintaining airway flexibility. These techniques prove particularly valuable for individuals with existing respiratory conditions but benefit healthy seniors equally. Vaccination against respiratory infections, particularly influenza and pneumococcal pneumonia, provides essential protection against conditions that disproportionately affect older adults. Similarly, avoiding crowds during peak respiratory illness seasons and practicing meticulous hand hygiene reduce infection risk that could trigger serious respiratory complications. Consider your respiratory system as precious infrastructure requiring consistent maintenance rather than crisis intervention, like preserving a historic building. Proactive, regular care prevents deterioration much more effectively than emergency repairs after significant damage occurs. Your lungs have faithfully processed millions of breaths. Throughout your lifetime, they deserve thoughtful protection during their remaining service. Lung-3 maintaining cognitive vitality. Keeping your mind sharp. Few aspects of aging generate greater concern than cognitive decline. The prospect of losing memories, reasoning ability, and ultimately personal identity creates profound anxiety among seniors worldwide. Fortunately, substantial research demonstrates that cognitive function responds remarkably well to targeted interventions, even in advanced age. Brain health represents dynamic potential rather than predetermined decline, emphasizes Dr. Nathaniel Parker. While certain age-related changes inevitably occur, the brain maintains considerable neuroplasticity, the ability to form new connections and adapt to challenges throughout life. This capacity allows for significant cognitive preservation when appropriately stimulated. Mental stimulation provides fundamental cognitive protection. Activities requiring active information processing, reading, puzzles, strategic games, learning new skills create what neuroscientists call cognitive reserve. Essentially, additional neural networks that compensate when primary pathways become compromised. This reserve explains why individuals with lifelong intellectual engagement frequently maintain function despite developing pathological brain changes. Social connection offers equally powerful cognitive protection. Research consistently demonstrates that seniors maintaining regular, meaningful interactions experience significantly lower dementia rates compared to socially isolated counterparts. These connections provide intellectual stimulation, emotional support, stress reduction, and purpose, all contributing to brain health maintenance. Physical activity influences cognitive function through multiple pathways, improving cerebral blood flow, reducing inflammation, stimulating growth factor production and enhancing neural regeneration. Even modest activity, walking 30 minutes several times weekly, significantly reduces cognitive decline risk and improves performance on memory and executive function tests. Nutritional factors significantly influence brain health outcomes. Mediterranean-style eating patterns emphasizing vegetables, fruits, whole grains, healthy fats, particularly omega-3 sources, and lean proteins consistently demonstrate superior cognitive protection compared to typical Western diets. Additionally, adequate hydration, appropriate vitamin levels, particularly B-complex vitamins, and moderate alcohol consumption should, if any, further support cognitive health. Consider your brain as your most precious asset, containing your accumulated wisdom, cherished memories, and fundamental identity. Like protecting irreplaceable treasures, cognitive preservation requires thoughtful, consistent attention rather than sporadic efforts. The investment yields tremendous returns, maintained independence, continued learning capacity, and preserved connections with loved ones throughout your remaining years. Why 4. Cancer prevention. When your body deserves careful listening, the sobering reality that many cancer diagnoses occur only after disease progression creates understandable anxiety. However, this common delayed detection pattern doesn't reflect cancer's inherent undetectability, but rather our collective tendency to overlook subtle warning signs until conditions advance significantly. Developing greater body awareness represents your strongest defense against this formidable health threat. Cancer detection involves partnership between medical screening and personal vigilance, explains Dr. Rebecca Hamilton. While regular preventive screenings identify many malignancies before symptoms develop, equally important is patients' awareness of subtle body changes that might indicate developing problems between formal evaluations. Develop the habit of regularly monitoring your body for unusual changes, unexplained weight fluctuations, energy level alterations, digestive pattern changes, unusual pain patterns, or visible skin transformations. Document these observations, noting duration, intensity, and any associated factors. This systematic approach transforms vague concerns into valuable clinical information for healthcare providers. Preventive screenings represent essential cancer defense strategies. Age-appropriate evaluations, colonoscopy, mammography, prostate assessment, skin examinations, lung screening for appropriate candidates frequently identify malignancies in presymptomatic stages when treatment outcomes typically prove most favorable. Discuss appropriate screening schedules with healthcare providers based on your personal risk factors. Lifestyle modifications significantly influence cancer risk profiles. Tobacco avoidance, moderate alcohol consumption, if any, regular physical activity, plant-centered eating patterns, healthy weight maintenance, and sun protection all contribute substantially to reduced cancer incidence across multiple malignancy types. Importantly, these interventions provide significant benefit even when initiated after age 65. Environmental awareness deserves particular attention, as many carcinogens accumulate in living and working environments without obvious warning signs. Minimize exposure to household chemicals, industrial solvents, pesticides, air pollution, and radon. Similarly, carefully evaluate supplement and medication use, as some compounds may increase specific cancer risks when used inappropriately. Remember, your body represents an exquisitely sensitive communication system, constantly providing status updates about internal conditions. Cancer rarely develops overnight but typically progresses over months or years, during which subtle signals gradually intensify. Learning to recognize and respond to these early communications represents your strongest defense against this serious health threat. Why 5. Fall prevention. Protecting your independence one step at a time. While dramatic diseases typically dominate health discussions, everyday accidents, particularly falls, frequently cause equally devastating consequences for seniors. A single momentary incident can transform an independent, active individual into someone requiring extensive assistance virtually overnight. Fortunately, comprehensive fall prevention strategies significantly reduce both incident frequency and severity. Fall prevention represents perhaps our most successful injury reduction intervention for older adults, notes Dr. Jennifer Lawrence. Multiple studies demonstrate that implementing targeted prevention strategies reduces fall incidence by 30–50%, a remarkable improvement considering the intervention's simplicity and low cost compared to treating fall consequences. Begin by evaluating your living environment for potential hazards. Slippery floors, inadequate lighting, loose rugs, cluttered walkways, or absent handrails. Simple modifications: installing grab bars in bathrooms, improving lighting in hallways and stairwells, securing carpet edges, removing obstacles from common pathways, dramatically reduce fall risk with minimal expense and effort. Regular strength and balance exercises provide fundamental fall protection by improving musculoskeletal stability, reaction time, and coordination. Programs like Tai Chi, specialized balance training, and progressive resistance exercises demonstrate particularly strong evidence for fall reduction when practiced consistently. Many community centers and senior facilities offer specialized programs designed specifically for fall prevention. Medication management represents another crucial fall prevention component. Many commonly prescribed medications, including certain blood pressure treatments, sleep aids, antidepressants, and pain relievers, may cause dizziness, confusion, or coordination difficulties. Regular medication reviews with healthcare providers can identify problematic combinations and suggest safer alternatives when appropriate. Vision and hearing assessments contribute significantly to fall prevention strategies. Impaired sensory function substantially increases accident risk through reduced environmental awareness. Regular examinations, appropriate vision correction, adequate lighting, and properly fitted hearing aids all improve environmental navigation while reducing fall likelihood. Consider your mobility as precious freedom deserving thoughtful protection. Like maintaining independence in other life aspects, fall prevention requires proactive attention before problems develop rather than reactive responses following injuries. The modest investments in environmental modifications, appropriate exercise, and regular health monitoring yield tremendous returns through preserved autonomy, maintained activity capacity, and avoided suffering. Kenslosone, your future health begins today, dear friends. Aging inevitably brings physical changes, but these changes need not automatically translate into debilitating illness or premature mortality. The encouraging reality is that many conditions commonly attributed to normal aging actually represent preventable or manageable health challenges when approached with appropriate knowledge and consistent action. The 5 warning signs we've explored: chest discomfort and breathing difficulties, persistent cough, sudden confusion and weakness, unexplained weight loss, and digestive changes, dizziness and balance problems represent your body's communication system at work. These signals don't appear randomly but convey specific information about developing internal conditions. Learning to recognize and respond appropriately to these messages allows intervention before situations deteriorate irreversibly. Similarly, understanding the major health threats facing seniors, cardiovascular disease, respiratory conditions, neurodegenerative disorders, cancer, and fall-related injuries provides essential context for interpreting bodily signals and implementing appropriate preventative measures. These conditions don't typically develop overnight but progress gradually over years, offering multiple opportunities for intervention if we remain vigilant and responsive. Most importantly, the longevity strategies we've discussed, nurturing cardiovascular health, preserving respiratory vitality, maintaining cognitive function, practicing cancer prevention, and implementing fall protection, provide concrete approaches for extending not just lifespan but health span, that crucial period of active, independent living we all desire. These strategies require neither exotic treatments nor expensive interventions, but rather consistent application of evidence-based practices accessible to virtually everyone. Dr. Marcus Wellington, longevity researcher, aptly summarizes current understanding. Today's gerontological science clearly demonstrates that chronological aging and biological aging represent distinct processes. While we cannot alter the calendar's progression, we maintain considerable influence over how our bodies and minds function throughout our later years. The choices we make daily, from physical activity and nutrition to stress management and preventive healthcare, collectively determine whether our remaining years bring vitality or disability. The question facing each of us isn't whether we'll experience chronological aging; that progression continues inexorably. Rather, we must decide whether we'll approach this natural process passively, accepting whatever health outcomes randomly occur, or actively implementing strategies demonstrated to preserve function and independence throughout our remaining lifespan. The encouraging message from current research is clear. It's never too late to make meaningful health improvements. Individuals initiating positive lifestyle changes in their 60s, 70s, and even 80s demonstrate significant benefits: improved function, reduced disease burden, enhanced quality of life, and often extended longevity. Your body maintains remarkable regenerative capacity throughout life when provided appropriate support. Today represents your opportunity to influence tomorrow's health outcomes. The consistent, small choices you make now: foods consumed, activities pursued, preventive measures implemented, warning signs heeded, collectively determine your health trajectory in coming years. You cannot change past decisions, but today's choices remain entirely within your control. If you've found this information valuable, please share it with friends and family members. Health knowledge becomes most powerful when widely distributed, allowing entire communities to implement protective practices before serious problems develop. Perhaps your awareness might help someone recognize early warning signs or implement preventative measures that literally transform their remaining lifespan.